Hello everyone, this video is about how to treat patients suffering migraine, but in the first step we need to know whether the patient fulfilled migraine criteria or not. So let's get started. Migraine is a disabling headache generally associated with nausea and light and sound sensitivity. The attacks last 4 to 72 hours if untreated or unsuccessfully treated, mostly with unilateral location, pulsating quality, moderate or severe pain intensity that may be accompanied by vomiting, phonophobia, and photophobia as we mentioned. Now that you've got familiar with this definition, let's get through the treatment that is divided in two parts: acute treatment that is pain relieving by using simple analgesics and antiemetic, and the preventative one in those experiencing more than 3 to 4 attacks per month. So patients with less than 1 attack a week are not indicated. Only the acute treatment would suffice in this group. However, approximately 30% of patients suffering migraine might end up with preventative approach. Now, let's see how to take approach to acute treatment. For mild to moderate attacks, we recommend simple analgesics with anti-inflammatory mechanism, including ACA that contains aspirin, acetaminophen, and caffeine, repeated every 4 to 6 hours if needed, but do not exceed 8 doses per day. Another agent is acetaminophen codeine that patients, depending on severity, can take 1 to 3 tablets initially. Also give an antiemetic like metoclopramide or ondansetron to patients if suffering nausea. These agents essentially ameliorate NSAID's absorption and mainly decrease migraine-induced gastric stasis. Apparently, you need to educate the patient that the earlier initiation of a large single dose, the more effective the treatment. Otherwise, they will need further repetitive small doses that presumably predispose them to medication overuse in the long run. Now, what if the patient suffers from moderate to severe headache? In that case, actually, if it's not associated with nausea and vomiting, they mostly benefit from oral triptans as fast-acting agents or a combination of sumatriptan and naproxen. Theoretically, we put patients on 2 tablets of sumatriptan 50 mg all at once, and this dose may be repeated once after 2 hours if needed. The maximum dose is 200 mg a day, that's equivalent to 4 tablets, but in practice, half the dose, the 50 mg will do the trick, and that provides better tolerability. And if the pain relief doesn't occur after 20 to 30 minutes, we're gonna